Well, it's a topic you're not always eager to bring up, and it affects many women. Urinary incontinence. We have our Dr. Koushik with us this morning to tell us all about it. Good morning.
Hey, good morning, Jenny.
So the myth is, or I guess the presumption many people have, is that this really affects older women, but that's not necessarily true.
Right. It is an embarrassing topic, and we usually think this is something that affects our grandmother or someone that's in their 70s, 80s, or something like that. But indeed, it really affects a lot of women, often beginning in their 30s, 40s, and 50s, and it can really lead to a lot of social problems.
So what is urinary incontinence?
Well, incontinence is when there's two major types. There's overactive bladder or urge incontinence. You see the commercials, gotta go, gotta go. That can lead to leakage and problems. And then there's stress incontinence, and that's the one that happens when we cough and sneeze, and that leads to leakage.
So what do people do about it? When do you know that it's not just something that's happened once or twice, or when you know it's actually a problem? Are there treatments?
Right. So for overactive bladder or urge incontinence, it's usually I've got to go to the bathroom once every 30 minutes, once every hour. It's really affecting our quality of life at work, at home, and social environment, sometimes leading to using pads, something like that, every single day to help control it. The important thing about that is that it can really be improved by a lot of dietary improvements. That includes reducing Cokes, coffees, teas, carbonated beverages,
caffeine,
energy drinks, anything that you like,
caffeinated.
chocolates even. Yeah, so you can really look into your diet and really improve overactive bladder just by making those changes.
What are we looking at right now if you take a look at that graphic?
Okay, so this is what we're looking at here is something called stress incontinence, and you can see in this situation someone's coughing, sneezing, or increasing pressure in their abdomen or stress, and that is being transmitted to the bladder. The muscles that help control that incontinence have gotten weak with time. And as you can see in that picture, they're coughing, and that's going to lead to urinary leakage.
So you're saying this can start as early as the 30s?
Sometimes in your 30s, and it's affected by, in this particular condition, things like obesity, diabetes, childbirth, especially if you've had multiple or difficult childbirths, that can affect stress incontinence.
Okay, so treatments that people can get, you said you can change their diet. Is there medication people can take as well? Or?
Right, there are medications that can help for overactive bladder as well as the dietary things that we talked about. For stress incontinence, there is the first line of therapy, which I call Kegel's exercises. That's something where women are taught how to do pelvic floor exercises to help strengthen those muscles to reduce leakage. Finally, if that doesn't work, there are surgeries that are available, some minimally invasive surgeries, sometimes that take less than 30 minutes, that can help cure a woman of their stress incontinence.
All right, great information. Thank you very much. As always, thanks for joining us.
Thanks, Jenny.